Hello everyone. Here we are going to discuss a small topic that is normal anatomy and histology of the respiratory tract. Nobody is going to ask you a question regarding that in your university exam, but it's for your understanding. If you understand this well now, all the topics in the respiratory pathology given ahead, you will have a better understanding of all of those. So first you have to understand the normal anatomy and histology of the respiratory tract. We are starting the topic that is normal anatomy and histology of the respiratory tract. So first of all, I will let you know the respiratory tract, the complete respiratory tract starting from nose till alveoli. Then we will see the pulmonary lobes. What is pulmonary lobe? Then we will see the pulmonary lobule. So if you have an understanding what is lobe, what is lobule in a lung, you will have a better understanding when I teach you the pneumonia. The lobar pneumonia involves the lobe. The lobular pneumonia involves the lobule. So you should have understanding what is lobe, what is lobule. And then I will let you know the normal histology of the lung. And finally, I will let you know what is alveolar septa. So let's start it. So you see, humans have a pair of lung, the right lung and the left lung. For respiration, the God has given us the lung. You can see the pair of the lung here. Now let me tell you the respiratory tract. I will draw the respiratory tract for you. So here I'm trying to draw the respiratory tract. So the respiratory tract starts from the nose. So let me draw the nose. So the person respires from nose and mouth. So it opens in the pharynx. So this is pharynx. Pharynx leads to larynx. So this is larynx. Larynx leads to trachea. Trachea leads to bronchi. Bronchi leads to bronchiole, primary bronchiole, which leads to secondary bronchiole, then tertiary bronchiole, then terminal bronchiole, then respiratory bronchiole, then alveolar duct, and finally alveolar sac. So this is complete respiratory tract. Let me write. So let's start from nose. This is nose. So after the nose, there is pharynx, and then there is larynx. After that, there is trachea. Then there are bronchi. These are the main bronchi, the two bronchi, the principal bronchi, the right and the left. Then there are bronchioles, the primary bronchiole, secondary bronchiole, tertiary bronchiole. Tertiary bronchiole leads to terminal bronchiole. After terminal bronchiole, we have three more things. What are those three more things? Respiratory bronchiole, alveolar duct, and finally alveolar sac. So the last three structures, can you see the last three structures? By last three structures, I mean respiratory bronchiole, alveolar duct, and alveolar sac. These three structures together known as acinus. Acinus is the structural and functional unit of the lung. Like glomerulus is the structural and functional unit of the kidney. In the same way, acinus is the structural and functional unit of the lung. Now let me ask you a question. Why God has provided us the lungs? Why God has provided us the complete respiratory tract? Do you know? Of course, the answer is respiration. So let's respire. So if I'm respiring, I'm inhaling. And I'm exhaling. So what do you mean? So if I'm inhaling, for example, I'm inhaling, where does the air goes? So air goes in my nose. From nose, it is going in the pharynx, larynx, trachea, the bronchi. So let's move the air here. So the air is moving from here. You can see the air is going in the nose, in the pharynx, in the larynx, in the trachea, in the bronchioles, primary, secondary, tertiary, terminal, respiratory bronchiole, alveolar duct. Finally, the air reaches the pure air, the oxygenated air, the air which contains the oxygen, it reaches the alveolar sac. What's ahead? All the alveolar sacs are covered by pulmonary capillaries. So this is the pulmonary capillary. All the alveolar sacs, the balloons like structure. These are the balloon like structure. They are covered from all sides by alveolar capillaries. So here exchange of gas takes place. In exchange of gas, the oxygen from here goes into the capillary and carbon dioxide from the capillary comes back in the alveolus, and after that we exhale. So just suppose, see, I'm inhaling. So air is going inside. It is reaching in my balloons. The balloons is the alveolar sac. Does the exchange and then I expire. So I inhale, I exhale. I inhale, do the exchange, and then I exhale. See, I'm inhaling. So air is going inside. It is reaching here in the alveolar sac. Here the exchange takes place, and after that I exhale. So I'm taking the pure air and I'm exhaling the impure air containing carbon dioxide. So this is the function of the lung. So here exchange takes place. So where is the exchange? Now what is the lining of the entire respiratory tract? The entire respiratory tract is lined by pseudostratified ciliated columnar epithelia. The entire respiratory tract is lined by pseudostratified ciliated columnar epithelia. It's columnar epithelia. It's pseudostratified means it looks like multi-layer, but it is not multi-layer, and it is ciliated. It's a special mucosal lining. It is ciliated. It is having the cilia hair-like structures on that. So the entire lining is pseudostratified ciliated columnar epithelia except the last structure. What is the last structure? The last structure is alveolar sac. The alveolar sacs are lined by pneumocytes. Type 1 and type 2. There are two types of pneumocytes. Type 1 pneumocytes and type 2 pneumocytes. Type 2 pneumocytes, maximum 90% are type 1. Type 2 are only 10%. So type 2 are required for surfactant release.